TRT World's health correspondent Nicola Hill is joining us from London with more on this. Hi Nicola, good afternoon to you. So just explain to us why blood clots are being associated with this vaccine.
It's very confusing, and a lot of scientists are saying, in fact, that these blood clots are not associated with the vaccine. I'm going to slightly blind you with some figures here, Kamali. There's been 17 million doses of this Oxford AstraZeneca vaccine given out in the UK and the EU, 11 million here in the UK. According to AstraZeneca, there's been 37 cases of these blood clots. That's a tiny number. Professor Andrew Pollard, who is from the Oxford team that developed this vaccine, has been speaking this morning, and he said that ordinarily you would see 3,000 cases of blood clots every month amongst the population. Because it's something that's very common and becomes more common as somebody becomes older, and of course it is older people who initially started being vaccinated. So he said, obviously, you need to have caution, but many people, particularly here in the UK, where it is being given out in such a widespread manner, are slightly confused by the decision to halt the programme. Now, when a trial is underway of any new drug, vaccine or anything like that, then there will be a halt in a trial when there's some severe side effect. But it's very unusual when you've got such a small number for a programme of this enormity and of this need to be halted in this way, because of course, you know, what is that doing to vaccine hesitancy? I mean, as you just said then in your introduction, the WHO, the World Health Organization, has said there's absolutely no issue and the vaccine should continue to be used. Here in the UK, the Medicine Regulatory Authority has said the same thing, and every country that has halted or paused the programme has said there is no link between the vaccine and blood clots, but they're just pausing for it to be investigated. So overabundance of caution, perhaps. Maybe it's just to make sure people feel confident that there is no link between. But as I said, with all those numbers I've given you, it's a very tiny, tiny number of people. So is it a coincidence? No cause, no real link that's been proven at the moment.
Yeah, absolutely. 37 out of 17 million jabs, Nicola. I'm not great at maths, but that is a tiny, tiny fraction of that amount. But as you rightly said, what does this do for confidence of people? Because there is vaccine hesitancy, it is prevalent, and people tend to look for an excuse to try and avoid these things, and perhaps this news out of those countries will give it to them.
Yeah, quite a lot of infectious disease experts here in the UK have been commenting on this. Professor Adam Finn from Bristol University has said that, you know, at a time when we are having to persuade people to be vaccinated because of what COVID-19 is doing, perhaps doing something like this is not a sensible suggestion. There are theories. There are theories that perhaps the people who have been infected may well have had COVID-19 when they went to get their vaccine, or they contracted it immediately afterwards, because we know it takes a while for immunity to build up. And the main thing, of course, is that COVID-19 does cause these coagulation problems, which is either too thick blood, sticky blood, which causes strokes, or too few platelets, thrombocytopenia, which is a bleed. And certainly when we first had reports of people being hospitalised with COVID-19 in China last year, 30%, that's nearly 1 in 3 of the patients who were in hospital with COVID-19 had thrombocytopenia. So that's what many of the experts here are saying, is that, you know, the number 37 in 17 million doses is tiny. If you think of the number of people with COVID-19 who get serious illness, who end up being hospitalised, who die from strokes because of the virus, if this halting of the vaccination programme does cause this vaccine hesitancy, it's going to have very long-lasting after effects.
Yeah, it really could have a worse effect, couldn't it? Nicola, I appreciate you making that very clear for us. Thank you for now. Nicola Hill there.